Hey, it's Dr. Birchler. Wanted to address here, a point of conversation that sometimes comes up to help people understand what we're really trying to accomplish with spinal disc decompression, which is a big part of our practice here. And here's the idea and the phenomenon at play. When you're hurting, you're in pain, you want to feel better, and of course we want you to feel better. And at the same time, what we're doing is actually trying to address the root physical cause to basically facilitate the body's own healing or repair so that you feel better as a result of healing, versus pain treatment management, which is, hey, I don't feel good, and so I take a pill or a chemical or an injection or whatever. Doesn't address necessarily why I don't feel good, doesn't facilitate healing. In fact, often the opposite, it delays healing or blocks repair, but may feel better. So that's a concept of its own right. But here is the understanding. When somebody say they have a disc problem in their lower back, and they're doing spinal disc decompression, the purpose of decompression isn't to feel good. It may feel good. For some people it does. Commonly people with degenerative disc, it feels good. But it doesn't necessarily feel good, and the purpose is not to feel good. The purpose is to have a particular effect on the body, to have this kind of pump mechanism on the disc, and if there's herniation, to have this kind of centering, mechanical centering effect in the disc, so that with the correct amount of time, the body can have a nice repair of the kind of torn, injured, herniated disc. Good chance of dissolving or resorbing the herniation, kind of the jelly that's out of the donut. Shouldn't be there. Body will dissolve that. It's called resorption. So that's what we're trying to accomplish. It may or may not feel good, and whether it does or doesn't feel good doesn't necessarily mean it's working or not working, or it's not the right thing. Though of course we want to factor all of those kind of things in. And if somebody has pain or spasms or something, there are times where we certainly use that feedback. But I think you understand what I'm saying. And so just to understand this a little bit better, let's say somebody breaks their arm and the doctor puts a cast on the arm. Is the purpose of the cast to feel good? The answer is really no. The purpose of the cast isn't to feel good. Doctors doing what they need to do so that as the body of its own accord repairs the bone, which it will, it heals with good alignment and future function. Let's say somebody gets a cut and they get stitches. Is the purpose of the stitches to feel good? No. The purpose of the stitches is really bond the tissue together, so as the body is healing the injury, which it will, of its own accord, it heals with less chance of scarring, those kind of things, right? Deformity and whatnot. May decrease the risk for infection, all of that kind of thing. So in both of these, well, all three of these cases, from disc decompression to a cast to stitches, the doctor's doing something mechanical to the body, some physical application of force. One's a brace, one's a stitch, one's a kind of a pull, type of phenomenon with decompression. And the purpose of none of them is to feel good, but they're to do the right thing so that as the body's healing of its own accord, you get a good outcome. And so that's what we're trying to do with spinal disc decompression. May or may not feel good. We'll do the best we can and stay in good communication to balance all of that, but just wanted to make that clear so you kind of understand, if you're going through this, what we're trying to accomplish, how it'll go, what the purpose is or isn't, and that's going to help you get the best result in the long run instead of thinking something should happen and that's not even really why it's done. And so you can see it through, get a nice result, and stay out of back surgery, injections, and all those kind of things. Hope this is helpful to somebody out there. If you have questions about your particular case, you ask me and let me know. We want you to get the best results possible.